All right. Well, thank you. It's about 12:01, so we're going to get started. So thanks everybody for joining us today. We are recording this, so we will send it out to everybody else later on. But we just wanted to, every year we do a kind of beginning of the year update and kind of what the year looks like ahead. And so we're going to be doing that today. I'm looking forward to 2024, especially because it hopefully will be a normal year where there's no COVID, there's no post-COVID, there's no Colin leaving after a month and me doing it all by myself for a year. So we are fully staffed for 2024, and we're hoping to have a very, I guess, normal year finally. I say that, and then there's also an election at the end of the year. So how normal could it really be this year? So we're going to get started here, kind of go over some of our things. But before we do that, I just wanted to introduce Greg for those that haven't met Greg, because he started in October. And Greg, I'll give you a minute to kind of, let everybody know who you are.
Thanks, Matt. Appreciate it. Well, hello, everyone. As Matt said, Greg Bird, new to the team. I think this is my third month or so. I've really been enjoying working with Matt and the rest of the team at the association. And just great to be here, see everybody. Just if you want, just a little background for me. I was before the Alzheimer's Association. I was the legislative and advocacy director at the Michigan Economic Development Corporation. And prior to that, worked in two gubernatorial administrations and in both the Senate and the House. So I'm really looking forward to working with you and really appreciate the work that you guys do on behalf of the association. So yeah, thanks for having me.
Great. Thanks, Greg. And we are very happy to have Greg on our team. He brings a lot of experience with him and a lot of great connections in Lansing too, so that we've already been tapping into. So thanks, Greg. Just so everybody knows, on the call today, a little bit about our volunteer structure for those that aren't familiar. This call is for our Alzheimer's ambassadors, our Alzheimer's congressional team members, and our Alzheimer's state champions. Just a little reminder for people that don't know, our ambassadors, their kind of primary focus is the federal congressional members. Same thing with our ACT members, and our state champions are more focused on the legislator. They become a champion, create a relationship with their state senator or their state representative, and the governor also falls under that. But as always with the work we do, a lot of our state champions help us with some of our federal stuff, and a lot of our ambassadors and ACT members will also do state stuff. So it's an all hands on deck, but that's their primary focus of the roles and the people that are on this call or listening to the recording. And so we just wanted to let people know that. So I also kind of mentioned that too, because sometimes we have duplication of effort. And although that's bad in a lot of things, in advocacy, it is not. So having multiple people going into offices or multiple people talking to legislators is actually a good thing for us, because the more voices they hear, obviously, the more it will help us. So just here's the kind of the agenda for the day and what we're going to talk about. We're going to go over federal priorities and the congressional update kind of really quick. Most of this call is going to be used for the state priorities and laying out what the legislative agenda is this year at the state level. So that's going to be a big chunk of the time. We'll talk a little bit about Advocacy Day and actions that you can take. And then we'll finish with some Q&A with Greg and I to hopefully answer any questions you might have. So with that, I'm going to jump right into our federal priorities. For some of you, this is not new. We kind of have three or four main priorities right now. First is kind of appropriations, the budget. Under that, we're asking for $321 million increase for Alzheimer's research funding at the NIH, and $35 million to fund the BOLD Act. And we'll talk about BOLD Act in a minute. But the other other priorities we have are pieces of legislation that were introduced. Probably no surprise here to anybody on the call that National Alzheimer's Project Act, the NAPA reauthorization, is one of our main goals, getting co-sponsors to that. I'll mention Senator Stabenow is one of the original or the main sponsors on that bill. And then the Alzheimer's Accountability and Investment Act. And Senator Stabenow is also one of the original or main sponsors on that bill. So those are the ones. Just really quick, the National Alzheimer's Project Act was passed over 10 years ago. Before that, we really didn't have any national focus or strategy around how do we tackle Alzheimer's and dementia in this nation. And so once that was passed, then a report was created, a nationwide Alzheimer's report, annual report, and it's updated, that kind of put together the stakeholders and kind of gave us a direction of where we should go in this country. You know that there's a standing advisory council on that. The Alzheimer's Association has someone on. Dr. Joanne Pike, our CEO and president, is the person that sits on that. And that's really important because if you actually look back of where, and I'll use federal funding as one example, prior to this National Project Act being authorized, we were bringing in around half a billion, $500 million in research. Once we got organized, once we had a strategy, once we started passing legislation and doing other things, like the Alzheimer's Accountability and Investment Act, the first time that we put it through, you'll see that there was a direction. There was actually NIH coming out with how much money they needed for research. We advocated more succinctly in our advocacy as far as what monies we need and what they go for and how we came up with that money. It's not just something we pull out of the air. And since that time, we have seen regular increases in Alzheimer's research funding to get us to the point where we are now, where we're almost at $3.8 billion. So I don't think that happens without the National Alzheimer's Project Act, and that will end at the end of this year, and so it needs to be reauthorized so the standing committee can still be there so we can update the National Alzheimer's Plan and do all of those things. So the Alzheimer's Accountability and Investment Act kind of goes hand in hand with that. That basically creates what they call a bypass budget, and to put simply, it's goes right to NIH, asks the scientists, the doctors, and administrators at NIH to come up with a budget of what they need in the next year to continue on the progress they've had and not fall behind, and what they need to keep up with medical inflation or research inflation or whatever it is. And so then they come up with an actual number that they provide us and says, this is the money we need in the next budget so we can continue working at the rate that we're doing and continuing the investment of research. And so that's where we get the $321 million from this year. That is from the bypass budget. So that number is actually broken down at NIH of exactly what they think they need. And that's really important because, like I said, we're not just making up a number. This is also why it's not a rounded number. This is why you never see us asking for $100 million or $200 million every year. We're always asking for a specific amount because they've actually gone through and looked and said, this is how much money we need based on these different criteria. So the 321 is the easiest to remember this year because it's 321. I actually don't even have to look it up anymore because it's easy to remember. But we went $321 million. So the last thing I'll mention is just on BOLD. As you saw, we're asking for $35 million. The BOLD Act. Well, the BOLD, which stands for Building Our Largest Dementia Infrastructure, that runs out too coming up. And so this year we expect that reauthorization to be introduced, and we'll be working on that. So that's just an upcoming issue. And why is that important? Because the BOLD Act takes that money and they fund projects within the states and fund different things out there. So that's money that can come back. And up until last year, it was never coming back to Michigan. But thanks to our dementia unit, we now have been granted last year $1.85 million over the next 5 years in BOLD funding. So, so that's really important for us, and it's great to see that now Michigan has actually got some of that money coming back. So just a couple activities for on our federal priority issues. Ambassadors, most ambassadors know this. You guys are in the middle of setting up district meetings, talking about these things between now and March 1st. Many of those meetings have taken place. Many people have reported on those meetings. They're going really well. So thank you for all of that. Right now, at this time, we're asking ACT members to do district office drop-bys. We have fact sheets on all these issues, and we would love to have just that one more touch point with the district office and ask all of our ACT members to do a drop-off, hopefully during February, to drop off those sheets. If it rolls into March, it rolls into March. But all of this is kind of in preparation for us in the beginning of April to go to Washington, D.C. with our ambassadors to do our national forum and our day on the Hill. So we're working towards that. And then state champions from the federal issues, you can do a district drop-by visit if you'd like. Once again, we can never have too many people walking through that district door, dropping off our materials and saying this is important, because the more constituent they hear from, the more serious they're going to take it. So that's kind of where we're at with the federal priorities. I know I'm talking a lot, and soon I'll hand it over to Greg for some more other issues. But as we roll into the Michigan legislature priorities and what we're going to do here in the next year, Michigan specific, not dealing with Congress, dealing with our Michigan state senators and state representatives. First thing up is the dementia unit. And the first thing to announce on that is that the dementia unit has a new name. And the dementia unit is now the Dementia and Healthy Brain Unit. And you might be asking, why did it change or whatever? Well, the good news is that we have formalized within the Michigan Department of Health and Human Services Chronic Disease Division, the unit itself. So when we passed the money way back when, we got the money for the unit, they put it in the coffers. They actually have to go through a specific kind of official procedure to become a unit, and that takes time. And so with the hiring of staff and then the bold money, and then this process has finally come full forward, we now have finished that process, and now it is officially a unit. Although it was pretty much officially a unit before, because the money was there, we're now officially a unit. So the Dementia and Healthy Brain Unit is there. You'll be able soon to find it on, employee charts for the division and things like that. So it is officially there. And one of the big things with that is that means more staff are coming. Because we got the bold grants, we already have one staffer in. If you were at Advocacy Day last year, you met her. Her name is Dana Strang. She is our public health consultant dementia within the department right now. She's been kind of the one-person crew for the whole thing over the last year, and they've done a lot. They will be hiring a unit manager to oversee Dana with this year, and then they also will be hiring a bold coordinator that will work on the bold grant and coordinate that. So our little staff of one is going to blow up to 3 this year. But that, to kind of put that in perspective, I don't think it's probably no surprise to anybody on this call, but the legislature does not move super fast. Also, the bureaucracy sometimes moves even slower. So for us to actually do all of this within a year, last year, right now, we were just announcing that Dana was hired. And now we're announcing they're going to hire 2 more people. So in just, not even a year and a half since that money actually hit the rolls of the state government to have all this happening is actually really fast and really successful. So so thank you all, because all of you and the people I see on this call right now, I know have all been involved in this from way early, trying to get this money and get this happening. And now it's just great to see what's going on with it and all that. And so that leads us to our ask this year. So our ask is we want to increase funding by $2 million for a total of $2.4 million for fiscal year 2025. And that is a large ask, but we believe because of certain things, we have a strong case to make for that. One is the success of the Dementia and Healthy Brain Unit over the last year. A second one is what's going on in other states. And the third one is that we feel like we are now in the position where the legislature needs to allocate real money towards dementia and Alzheimer's. So everybody on this call knows the strategy was a low money ask early on just to get the dementia unit created. because we felt if it was a low money ask, we could get it created, hopefully get it funded and created earlier, which we did. Because when we started that, we thought it was going to be a 3 to 5 year process just to get that money, and it happened a lot faster than that. So we were successful there. Now we're going to look to expand it. So what does that expansion mean? So the $2 million increase would allow us to do a lot of different investments. One, it'll allow us to support for the bold and the match. We actually have to provide a matching fund for the bold. Now, that's not money that we would just provide and it goes away, but it's money that the dementia unit has to match for bold, and that money can only be used for specific things, right? So obviously, with our $400,000 that we have now, some of that money has to go to the bold match, and it has strings attached to it. We can only use it for certain things. So a new investment of money would loosen those purse strings a little bit, give us some more money that were more flexible for us. A major part of this is going to be an Alzheimer's and dementia navigation program. And so they have this for other chronic diseases that helps people navigate a disease when they get a diagnosis. That can include care coordination, follow-up, dealing with insurance issues, support for getting treatment or where to get treatment, diagnostic support. Now, as far as the treatment thing, you might be asking, well, there's not that much treatment on the books right now, and how much help are they going to get? Well, one, we're already seeing a need for that, but two, we have more treatments coming in the pipeline that we see. Keep in mind, if we get this money, it doesn't even hit the books until October of this year. By the time a navigation program would be up and running, would probably take a whole nother year from there. So, you get the money now with the hopes that by 2026, you're up and running. That's a long time from now, and a lot can happen on this front between now and then. And from the people we've talked to, we think a lot is going to happen on that front. And also with treatment, there's a lot more that goes into it. You have to get PET scans and diagnostics to go with that, and those aren't just available around the corner. So we see a navigation program in the future here being extremely important for the people that are in this. Whether there was treatment or not, we saw it important because people deal with issues with insurance all the time, deal with issues with Medicaid, they deal with care coordination, things like that. And so that's what a navigation program would be able to help with. And what would that mean? That would be contacting somebody up and getting kind of a caseworker that would be put onto your case, and then they kind of run you through, have you done X, Y, and Z? And if you have, well, now you need to do this, this, and this, or, have you looked for these different specialties in your area? If there aren't any, they can help find other specialties in different areas. The breast cancer and the breast and cervical cancer control program and the cancer section is very successful in this navigation program that they've been doing for years to help people navigate a breast cancer or cervical cancer diagnosis. And so the division has multiple navigation program examples to look at and say, we need to do that for dementia. And in fact, I will tell you right now, I said we need to do that for dementia, and that's why we're talking about it today, because we really need to do this for people that get Alzheimer's and dementia. So some of the other things, we're still sorting out some of the other investments that we would be doing because we have a new unit manager coming on. Actually, Dana, our public health consultant dementia over there, actually just got back from maternity leave. So we've kind of slapped together a lot of stuff right before she left. And then we're kind of waiting to get back with her on some more details of this. But this is some of the stuff we've come up with. Data collection and the creation of a data dashboard. We don't have a lot of data in this state, and we haven't been collecting it year over year. Community clinical linkages, connecting community to different clinics and different clinical trials that they're doing. An early screening project that they've been talking about wanting to do. Training and educational support. They did 13 mini grants last year that covered 37 counties that went out in this. They would love to expand on that to be able to contract with even more health departments on doing different things and organizations. And then more prevention support, especially to address health disparities. So those are just some of the things. I think there will be more. Honestly, they're probably the sky's the limit as far as ideas they have of things they'd want to do if they had the money. So, I mean, we're in the position where they could give $10 million and they could find a way to successfully use $10 million and stuff. That's not going to be the problem. The problem is they don't have the funds to do everything they would love to do. So our goal is to start providing them with those funds so we can advance this further. With that, we have a new fact sheet that we have put together on this that we will be using a little different, a little the same as the one we had before. It might look familiar, but we have some other things that we've added in there, including the dementia unit successes, which I think are some of the things we should be proud of. It includes them landing. Yeah, when we advocated this, one of our main pushes was a dementia unit would allow us to be better prepared to apply for federal grants and get federal grants. And in the first year, we did that. And we got a $1.85 million grant. So we delivered on our promise to legislators that if you give us this money, we're going to have a great return on investment. And we did it in the first 6 months that someone was there, staff there. That's remarkable. So there's money coming in. There will be other opportunities in the future to get more money. The more staff we have, the more we can do. But that's a big success. I talked about the mini grants that we've done. They also developed and did a big social media public awareness campaign that went out and hit tens of thousands of people. And then also we've secured $30,000 for the behavioral risk factor surveillance system to do a cognitive decline model. That is basically kind of the annual questionnaire that goes out to people. It has different modules in it to collect data. And we were able to secure some money to include a cognitive decline module in it. We did a cognitive decline module in that a few years ago. We need to do another one. And so we were able to secure that. And I can tell you none of this happens if we don't have a dementia unit. So, or a dementia and healthy brain unit. I got to get used to saying that. If you couldn't see that little map on the fact sheets there, I pulled it up for you here. This is what I talked about too. Where does Michigan stand in our commitment to dementia compared to our neighbors? We're not good. And so if you're going out and talking, and we had Lisa Adkins go to Representative Christine Morse's coffee hours today, which is very important because Christine Morse is the chair of the Health Budget Subcommittee. And she talked about it. And she said, and I quote from her email, she asked for $2 million and people chuckled until she pulled out this map. And once you pull this map out, people don't laugh anymore because look how badly we're doing. We are way behind our neighbors in funding, and it's not even close. So our message should be very strong to our legislators this year that we have gone from zero funding of dementia to very little, but it's still drastically underfunded. In an aging state like Michigan, they should be taking this seriously and they should be allocating the funds towards that. So so this, I think, is going to be one of our strongest graphics that we can use with our legislators this year to see where Michigan stands because it doesn't paint a very pretty picture. And the best thing I love about this map is if you look at those states, this is not a Democrat or a Republican issue. We got Democrat-held House, Senate, we have governor. There's a Republican governor in Indiana and in Ohio. There's Democrats in Illinois. So whether you're a Republican or a Democrat, if you're in Ohio, Indiana, Illinois, or Wisconsin, they're taking it seriously. If you're in Michigan, they're not. And that would be my strong message to legislators this year is exactly that. So the truth, you know, it's the money is really shows you the truth. So that's what we'll be doing. Now I'm going to, if you want to hold your questions for the end, we'll be happy to answer them all, but I'm going to let Greg talk about our last few issues here that we're going to be working on and before we move on. So go ahead, Greg.
Thanks, Matt. Appreciate it. Yeah, so first issue I'll talk about is dementia training for guardians. There is a package of bills moving through the legislature, spearheaded really by the Attorney General's Elder Abuse Task Force. One of the bills within the package creates a Office of State Guardian Board, and that Guardian Board would put out or create a list of requirements in order to become a guardian in the state of Michigan. We have been working with the legislature and the administration to ensure that one of the steps that somebody has to take to become a guardian is to receive an annual training on dementia. And so we have received very good feedback thus far from both the bill sponsor and the chair of the Senate Judiciary Committee and the department. So we're pretty excited about this. There are a lot of issues floating around this bill package that will require work from what we're told by the chair's office. But our amendment does not seem to be one of those sticking points. So we have been told by the chair that they believe that they will start taking testimony on this bill package in March of this year. So we look forward to that. And there are 2 or 3 members of the committee that have said that they would be willing to offer the amendment to add that dementia training for us. So we feel good about that, but there's still a lot of work yet to be done. Want to go to the next slide, Matt? And then the next issue we'll be working on this year, and if any of you were able to catch the governor's State of the State address earlier this week, and she mentioned a caregiver tax credit. I will say, while we don't have a ton of information on what the governor will propose, she did announce that she would like to create a new Caring for Michigan Family tax credit. That would be up to it would be a tax credit of up to $5,000. The type of expenses that she had mentioned in her fact sheet include counseling, transportation, nursing or respite services. And so, we look forward to seeing the bill or getting more details. We anticipate we will see the governor's going to present her budget for the coming fiscal year on February 7th. So we are under the assumption we'll get more details around then. And we're happy to keep this group up to date in terms of the details when those come out. But we think this is a great thing that could happen and help save a lot of people a lot of money in caring for folks. So looking forward to working on that as well. Matt, do you want to go to the next slide? And then finally, Representative Julie Rogers from Kalamazoo has recently introduced House Bill 5397, which creates a silver alert in the state of Michigan. Michigan is, I think there are 37 other states that have some type of silver alert. And so that will be something that we'll be working with the representative on as it moves forward. In fact, we have a meeting with her coming up in a couple of weeks where we'll discuss this. But basically, the legislation allows the Michigan State Police to send out an alert if someone goes missing. And so we're excited to work on that with the legislature and the administration.
And Greg, I just mentioned that Representative Neil Frisky did also introduce a bill, but it'll be no surprise to people on this call. Julie Rogers is a Democrat. They hold control. Neil Frisky is a Republican. They don't. So the bill that's likely going to move is Julie Rogers. And it was referred to her own committee, which she chairs. So we do expect action on this bill this year. Whoops. Got ahead of myself. Oh, dementia training for first responders. So thanks, Greg, for all those updates. And then just one issue to kind of be on the lookout for coming up that we're looking at is an issue on dementia training for first responders. We actually had hoped to get this issue kind of introduced earlier and stuff, but with the tax credit and the silver alert and some other issues that have been thrown in, this has gotten slightly delayed, which is a good thing because in the past we haven't had all these issues that are out there to benefit people with Alzheimer's and dementia. So it's great to see all this activity around those issues. But we're looking at doing a dementia training for first responders bill. Um, this is an effort we would lead, and we have already identified a sponsor. Rep. Sharon McDonald from Troy has agreed to sponsor that. She has a personal connection with the disease, and is very eager to work on this. And likely what we're looking at is probably a fall introduction. I mean, basically the strategy Greg and I have kind of laid out is we'd love to get something introduced before the end of the year. This year, simply because it makes it that much easier to reintroduce something next year. If something's already out there, those bills coming in 2025, because 2025 will be a new session, which means all bills are dead at the end of this year and everything starts over in 2025. But if there was pre-existing legislation from the previous session, it's easier to reintroduce something quickly in the new year. So, a lot of people will ask, why are we introducing a bill when they're almost done with the session? That's the strategy behind it, is if you at least get something written and through the Legislative Service Bureau and out there, it's that much easier to get it done and done quickly when you get into the new session. So that's an issue. And that would be a dementia training requirement for first responders. So imagine police, fire, EMS, and that type. I'll share one quick story about this because I think it's very interesting. We mentioned this at our staff meeting recently, and one of our staff, David Hind, covers Genesee County and does our programs, because some of our staff go in and do kind of mini trainings with first responders on this. He went to the Grand Blanc Police Department in the morning and did them, and they have a morning call and an evening call for their shifts. And he went to the morning call and he presented kind of some training on how to deal with people with Alzheimer's and dementia, and how to approach them, with a calm and soothing, and just how to approach them and how to deal with these things. When David returned for the evening call to do this with the evening folks, one of the officers from the morning came up and told to him that he had an encounter that day with someone with Alzheimer's and dementia, and he approached it as he would a regular one. And when he saw the lady at a gas station sitting in her car, looking like he thought this might be someone that's not understanding what's going on. And so he changed how he approached her completely based on what David told her. And instead of "I'm officer," whatever, said, "Hey, I'm Bob. What's going on? Are you okay?" To find out that the lady didn't know where she was lost. They were able to get a hold of his son. They were able to get it resolved without any escalation or anything at all. And he basically talked about how that training had helped him that day. So I think that's just a great example. I'm sure it's not going to happen like that with every training we do, but it's a great example of, the type of training that's necessary. And in fact, that police department has asked him to come back and provide training more often. So it's something that as we've been out there pitching this issue, we're hearing more and more of that this is actually something that's wanted by a lot of the police departments and the first responders. And so that's something that we want to make sure that we're promoting and pushing and getting legislation passed for that. Additionally, this is something that Ohio recently passed this. West Virginia recently passed a version of this. So it's something that's being done in other states, and we think it's time that Michigan also do that. So that's something to look forward to as we move into the fall. So with that, I'm going to move in this Michigan State Advocacy Day. Michigan State Advocacy Day is May 7th this year. It's a little later than normal because of conflicts with different events and with availability of the rooms we use. We will be back in the House office building in the morning in the Mackinac room like we have done in the past. We'll finish up in the state capitol again this year. Once again in Heritage Hall. Last year was our first time in Heritage Hall. I thought it worked out really well. You could actually hear what everybody was saying, which is one of the downfalls of being in the Capitol Rotunda is it's very loud, it's chaotic, there's school groups coming through. It's a great visual, but for us to finish our thing, it wasn't necessarily the best venue. But we do love being in the Capitol at the end of the day. So we will end in the state capitol. The likely legislative issues that we're going to talk about, I can tell you for a guarantee, we're going to talk about the $2 million increase for the dementia and healthy brain unit. The other ones that we're considering are the caregiver tax credit and silver alert. And we very well may take all three issues in the State Advocacy Day. And depending on the level of comfort of advocates, they can talk about all three, or they can talk about the dementia and healthy brain unit and then share a story that relates to the caregiver tax credit, or share a story that deals with silver alert or something like that. So we're still sorting that all out, but those are the issues you can expect to see around Advocacy Day this year. So that leads me to actions for advocates on these issues. We kind of talked already about ambassadors and doing the congressional district office. Also, any help on any of these state issues is greatly welcomed. Same thing applies for ACT members. We're focusing on the drop-bys in congressional offices right now, but any work on these state issues is also welcome. And then for our state champions, what we're asking for in the next few months is for state champions, if they can, to meet with state senators or state representatives to talk about especially the $2 million increase for the dementia unit. A lot of that everybody knows about and can talk pretty close to, but also we can start talking about the tax credit and about the silver alert. These are also needed things. These are already things by the time we get out there, they're kind of introduced in moving. You can always talk to me about what issues are best for your legislators. For instance, you can call me up and be like, Matt, which of these three issues should I talk about? Well, based on your legislator, they could be on a committee that matters more, or maybe one of these pieces of legislation is in that committee that we're like, well, you should really talk about this because it's going to be in front of their committee. And I'm happy to work through that with anybody that wants to, but really we need to just be getting out pre-advocacy day in the next few months and getting people to attend any coffee hours. I already mentioned Lisa Atkins went to that coffee hour today and started the conversation with Rep Morse about the dementia and healthy brain unit. So that makes an impact. That matters, you know. And so folks that can do that, if it's not possible to get out to those things, other options are to set up a virtual meeting with their office, just set up a phone call. We've actually had a lot of success in the last couple of years just setting up a phone call. And the beauty of that is a lot of times we get a direct phone call instead of with a staff person with the legislator. So we've had a number of state champions and ACT members and ambassadors just have a 10, 15-minute call with their state rep or their state senator to talk about one or two of these issues. And so, you know, that matters too. You know, that direct contact makes a huge difference. So that's what we'll be asking state champions to do in the next few months here, is to hopefully do one of those things. Set up a phone call, set up a virtual meeting, or do a coffee hours, or maybe even set up their own meeting. We have had many of our advocates do that too. Call up and say, I'd love to meet with the state representative. And they've gone and met with them at a coffee shop for 20 minutes. You know, I see Joyce is on the call, and her meeting was at a coffee shop with the staff of her member of Congress, but very informal, but very productive and very direct. So those work. And, you know, we need as many people out there as we can working on all these things. We've used this as an example many times. We never know who's going to be on committees from session to session, and we also don't know where all these bills are going to end up. Greg and I have joked in the last few months, like, we could have never guessed a year ago that we would be focused so much on the judiciary committees in both the House and the Senate. But with the Guardian training that we've been working on, that's where our focus has been. We've never worked with Judiciary Committee before, but we are today. And so, you know, we just don't know where these bills, and there are more bills now being introduced and more issues being taken on. So, you know, we need people from all over the state. So that's another thing. So, and as always, advocates can work both federal and state issues. We have our focused areas, but we always need to help on all things. So the last thing I'll add, I forgot to mention this about State Advocacy Day, is that registration for that will start in February. So you can expect to see the registration for State Advocacy Day coming out at that time, and people will be able to start registering. So with that, I'm going to open it up to, well, first I'm going to ask if Greg has anything last things to add, and then we'll open up for questions.
Nope, I'm all set.
All right, well then we will be happy to take some questions if anybody has it. We have definitely have a few minutes that we can use.
I think, Arnie, you have your hands up.
Oh, yep, I see it.
Yeah, I've got two quick questions about the silver alert. Since there are already a number of alerts in place, like the Amber Alert and that, what does it really take to potentiate and add in a silver alert to the system?
That's a good question, Arnie, and I'm happy to, if the group would like, I can copy and paste the link to the bill so you have it. But it really depends at the end of the day, to your point, how they set this up and how the state police would administer it. There has been in previous legislative sessions where this issue has been talked about, there has been some concern from law enforcement on having too many of these alerts and people getting alerted on their phone too many times, and therefore they'll end up not paying attention to the alerts anymore. So there are in other states, there are methods that silver alerts are used. If you all recall driving on the highway and you see the signs that say, there are ways to run silver alerts through social media channels, through the web and everything like that. So again, it all depends on how this gets set up. I mean, as I read the bill that was just introduced, it's quite vague in terms of how it would be done. So I think that issue is probably still up in the air right now. But it's a very good question, and I'm sure one that will be hashed out as the process goes forward.
The second question that I had with pushing forward to mention Alzheimer's training to first responders, is that in addition to the national initiative that's out there for mental health training?
Matt, I believe, tell me if I'm wrong, Matt, but I believe that's correct. That is in addition to. In other states that they have done the training, I think Matt mentioned a couple. The Alzheimer's Association at the national level has a kind of a video training course that we could lend to the first responders in these different units. So it really is about an hour long. So for very little to no cost, this training could be administered to these first responders. And again, we hope that they would do it on an annual basis. But yeah, we could provide them with the video from that we have provided other states as well.
Thank you.
Sure.
All right, Diane, you had a question?
I do. Thank you, Matt. I can't tell you how important this first responder issue is, because my husband was 65 years old, perfect health physically. So when they went to his memory care center, they just weren't thinking, and they were going to sedate him. They were going to strap him down with literally, not chains, whatever you call those things on the gurneys, which of course made him more aggravated. So I actually called St. Clair Shores paramedics and talked to them and said, did you not have a clue? The place says Beechwood Memory Care. And I had a long discussion with them, and he said he would get in touch with people to get some training. So I from a personal standpoint, this has just been wonderful to hear. And I am so happy about this part of it.
Thanks, Diane. Thank you for sharing that story too, because we talk about these issues all the time, by the way, and we're always like, sometimes we hear some stories from folks, but we know they're out there. And sometimes we hear the stories and sometimes we don't. So it's great to hear these examples of where these things apply, and where they could be helpful. So, and that's what's going to be helpful when we go and advocate for it, is
Absolutely.
sharing exactly your experience, Diane.
I absolutely agree, Matt. And Diane, again, as Matt said, thank you for sharing that story, and any other stories out there like that, we'd love to hear them. You know, Matt mentioned the story about the Grand Blanc police officer. When the time comes, we are going to ask that police officer testify in front of the legislature to tell that story, because I think it's very powerful coming from him. And so those types of stories are very beneficial to our advocacy efforts. So any of those stories that you or any friends might have, we'd love to hear them.
Bertha had a question. Go ahead.
Yeah, this is about the guardianship training, which we've been working on. You said, if I remember correctly, you said that there's going to be a Senate hearing testimony in March.
Correct. That's what we were told by the chair's office.
Okay. Is there a method by which advocates can submit a testimony either in person or in writing, and where would I find that?
Yes, that's a great question, Bertha. And yes, there is. You could either submit testimony in writing or you could come in person. There are also, depending upon the chair and what their schedule is, some also continue to allow virtual testimony. So if that's something that you prefer as well, you know, that would be something that we could help work out with the chair's office. But all three of those options can be available. And when it gets closer to March and we know when the hearing is going to be, you know, Matt and I could happily, if you're going to do a written testimony, Matt and I would be happy to submit the testimony to the chair's office on your behalf if you'd like. Or there is an email address to the clerk of the committee that I can provide if you want to do it directly. However, whatever is easier for you. But I think once we know when those committee hearings are, we can certainly let you know.
Great, thank you.
Yep.
Does anybody have any other questions? I don't hear or see any. So with that, I want to thank everybody for everything they did last year before we jump into this year. Oh, Ron, go ahead.
Matt, I accidentally hit the mute thing.
Go ahead.
What I wanted to say is welcome, Greg. Thanks for helping out. And also, I do have a question. What would you say would be the key thing if I want to get a virtual meeting with one of the senators, say, and Congress people? What would you say would be the to get their interest? How would you approach it? What's your thoughts on it?
Ron, for you, given your history with Senator Runestad and Rep. Matt Maddock that we've hardly ever met with in Lansing, I would contact them and let them know that you've been to Lansing a couple of times and have missed the legislator, and you'd love to set something up virtually with them to talk. And the best strategies are to say just for 15 minutes, because you don't know if it'll be 15 minutes or longer, but you know, you just want to have a conversation with them for 15 minutes. If you could do something virtually, all the offices now are equipped to do virtual meetings. So that's a positive. And then in your situation, Ron, I think I would share your situation with your wife, and that it is not convenient for you to get out and try to meet with them out of the house. Much more convenient in your circumstance to just do a virtual one. That's what I would share, and then hopefully they can. And I see Senator Runestad is your senator, and he is on the Judiciary Committee, so the guardianship bill will go in front of him. So if you're looking at meeting with him, then that would be my suggestion: is contact his office and let him know that you haven't been able you've been to Lansing several times, and you've never been able to meet with him face to face, and your wife is, has this disease, so you're home a lot, so you'd love to set up a virtual meeting for 15 minutes. That's what I would do.
Very, very much appreciative
Yep.
on that response. Thank you.
Thanks, Ron. There aren't any other questions. Once again, just want to thank everybody. We've had a lot of successes in the last few years, and they're attributed to everybody on this call and those that are going to listen to this call. So we thank you for everything you've done, and we keep pushing ahead and expanding on our successes with the Dementia and Healthy Brain Unit, and our successes at the federal level. And if you guys have any questions at any time, feel free to reach out to me or to Greg with those questions. And if we don't have the answer, we will find the answer and we will get it to you. There's a lot of legislation going on, and we do not expect you guys to be experts in all that legislation. You guys are experts on your story, which is what we need. And we're supposed to be the experts on the legislation, so we'll be happy to answer any questions you have. And also, when you're meeting with lawmakers, once again, I'll just reiterate, you don't need to have all the answers. If they ask you something you don't know, just say, you know what, I'm going to talk to the Alzheimer's staff and they're going to get back to you on that. And Greg and I are happy to follow up with your state senator or your state rep or your member of Congress's office if they bring up some issues that you don't know the answer to. It's fine to not have the answers. So just let us know and we'll do that follow-up. But I wish you luck. And if you need any help from us, please just reach out and we'll be here. So thanks, everyone.
Thank you.
Thank
Thank
you,
you.
everyone. Take
Thank
care.
you.